Secretary Health, Shri Apurv Chandraji, senior officers from the central government, Secretary Health and MD NHM from the state governments and UTs, and all our esteemed audience. It is my pleasure to join you all on this very, very important occasion of World Population Day 2024. I extend my greetings to each one of you. As Secretary Health was also mentioning about the rate at which the population of the country is growing, World Population Day in fact is a significant one for a country like ours, which is home to 1/5 of the world population, and more than 65% of our population is actually falling in the adolescent and the reproductive age group. Hence, today is an occasion for us to reaffirm our resolve to ensure access to reproductive health services to individuals and couples. And it is a collective responsibility. When I say collective, it means the union government and the state governments and UT administrations have to work with each other to make sure that we are empowering our individuals and couples to be able to exercise their choices insofar as their reproductive health is concerned. Well, having said this, I would urge each one of you to contribute the best you can to make this World Population Day 2024 campaign a big success. We've been holding this campaign since long, and as RAS and MD Mrs. Patnaik mentioned, that there is a change this year in the way the entire campaign has been designed. Earlier, our campaign used to be divided into 2 phases, 15 days each. This time, we have extended the campaign, so we have 3 phases. We have a preparatory phase, which is over. We have a community mobilization phase, we're through with it. And today, we are entering the 3rd phase, which is that of the health services delivery. We continue it for a fortnight, and today we also have our Honorable Minister unveiling a lot of new IEC material, which includes radio jingles, spots, and I would say the biggest attraction is going to be the Sugam model, very intelligently and very creatively designed, and I am very confident that it will be of great use when we put it up in our adolescent friendly clinics or our public health facilities, and each one of you should make the best use of it. These 3 phases will eventually be followed by a new initiative, an award ceremony, that is to reward the efforts of the states, UTs or districts who have been performing well when it comes to our family planning targets. India's family planning program, as we are all aware, is an old one. For 7 decades, we have been moving ahead with this program, and with time, it has evolved, it has adapted, and it has borne fruits, and that is evident in the indicators that we get to see in our National Family Health Survey reports. And if I talk about the most recent one, which is NHFS 5, it clearly tells us that the 2 big goals that we had under the National Health Policy 2017, one of them was regarding bringing down the TFR levels to 2.1. And it is very heartening to see that most of our states, 31 states and union territories, with their rigorous efforts and with their commitment to this entire agenda of family planning and population control, we've been able to achieve a TFR of 2.1 or even lesser. Just 5 states of Bihar, UP, Jharkhand, Meghalaya and Manipur, we have not been able to reach 2.1 or lesser, but I happen to hear the views of the Principal Secretary Health from the state of Uttar Pradesh, also Jharkhand, and I was actually very happy to see that they are taking keen interest in ensuring that with time these states don't lag behind, and like the other states and UTs, they are also able to achieve. These are most populous states, especially UP, which is my own native state, so I can understand the pressure also, but your new kind of initiatives, they speak a lot about your commitment. So we wish you all the best, and we are sure that when we have the latest figure in the next National Family Health Survey, we will definitely be able to achieve the targets of the national health policy. So if I say in terms of the first goal, of course, with the initiatives that we took, and I would specifically like to talk here about the program Mission Parivar Vikas, which we started in 146 districts covering 7 focus states, and later on we increased the number of districts also to 350. That program has played a huge role, because all these things that we are talking about, whether running an IEC vehicle, Sarthi, or increasing the basket of contraceptive choices, all that was a part of this program. Even the Saas Bahu Sammelan, which has been given a new form in the state of Uttar Pradesh and Bihar, where you have even involved the sons, and I think that was very important, and that's really commendable. So these initiatives have gone a long way in achieving the figures that we have today. When we started this program, the TFRs were supposed to be 3 or even more in most of the states. But now when 31 states are reaching 2.1 or even lesser, that's really an achievement. And another goal of the National Health Policy 2017 was regarding the met need of family planning to be taken at 90% at the national and sub-national levels. So with that kind of ambition also, we have been able to meet this target to a great extent, barring a few states, again UP, Bihar, Meghalaya and Mizoram, for which we still have a high unmet need for family planning. So here the administration and the government has to gear up a little more, and you have to intensify your efforts so that we have the maximum need of family planning being met for individuals and couples. Third important aspect was regarding increasing the modern contraceptive prevalence rate. It is also very encouraging that now the modern contraceptive prevalence rate has actually substantially improved to 56.5% at the national level. Just a few states, once again UP, Bihar, Meghalaya and Manipur, they have the MCPR, which is lesser than the national average. But I am very confident, because the degree of commitment that we see towards this program of the states and UT administrations and governments, we are very confident that sooner, when we have our revised figures, we will see a lot of improvement. So these are just 2 fronts which you need to address a little more. Overall, I would say that it is our collective responsibility, once again, center and states, to create an environment where our women actually feel free to exercise their right to choose whether they want to have children, when they want to have children, and how many children they want to have. And this year's theme, as you know, of the World Population Day is healthy timing and spacing of pregnancies for the well-being of the mother and child. So in line with this theme, we have to intensify our efforts collectively. We have to move forward. And please remember that the Prime Minister Narendra Modi ji has a big dream for India, to make India a developed country, Viksit Bharat. And when we say Viksit Bharat, then in the light of health, Viksit Bharat is the one where gender parity is not an aspiration but a reality. Viksit Bharat is the one where individuals and couples actually can plan their future with confidence and hope, and women are not burdened by unplanned pregnancies. And the slogan, we have a very beautiful slogan for the World Population Day 2024 this time, Viksit Bharat ki nayi pehchan, Parivar Niyojan Har Dampati ki Shan. So this is the broader message that we need to take to the general public, and let's rededicate ourselves to the goals of the National Health Policy as well as the National Population Policy. And I am sure if we make this our national priority, we will be able to set an example in front of the whole world that India is a nation which is a symbol of progress and prosperity. It is, we just have to set another example, and I am sure we can take this forward and make it a huge success. So once again, my best wishes and greetings to everyone who's joined us today virtually, physically on the World Population Day. Let's all come together and make it a big success. Thank you very much.